Can you tell us a little bit if it's ongoing or if you are planning, for example, clinical trials to strengthen the clinical evidence, especially in your field, in the field of gastroenterology, and many things have to be done in the past?
Well, we do have a beautiful evidences, not only in gynecology. I'd like just to quote a few data for the newborn, for example. I was just reviewing, also for this conference, Cochrane's about the evidence supporting the role of probiotics in reducing the consequences of the necrotizing enterocolitis of the newborn. We know that when children have delivery very early and with a very small weight, they're very, very vulnerable to this dramatic necrotizing inflammation of the bowels. When we use antibiotics, the rate of death, and not only of serious consequences, is very high. When these small children are treated with probiotic, they have a significant improvement and survival and outcome in general for all the goals of the health of the child are significantly better. So that there is a consensus in the world that these premature babies should be treated with probiotics and hopefully not with the antibiotics. In terms of percentage, we have a reduction in the consequences of the necrotizing enterocolitis by 35 up to 60% according to the studies, and a reduction in mortality from 20 to 35%. So really solid data to show us that we should reconsider the role of our best friends, the probiotics, in terms of promoting better healing and better long-term health. Other data, the other way around, show, for example, that when women, these are studies also in rats really, but in the rats, when we have a treatment antibiotic during pregnancy, not after delivery, these small rats have a significantly higher rate of early irritable bowel disease. This means that the antibiotic given to the mom has a devastating long-term impact on the bowel of the babies. We also know, a few people know, that the placenta has a gender. The placenta is a he or a she according to the gender of the baby. Well, we consider until recently that the placenta was sterile. No. We know now that the placenta has a microbiota, and this microbiota is modulated by the mom microbiota, and is critical to seed the beginning of the microbiota of the child. So certainly the mode of delivery is important, and we know that the vaginal delivery is best for the child general health and microbiota well-being if we do not have a major contraindication to the vaginal delivery, of course. But also now we know that there is this early passage that modulates the fingerprint of the child microbiota according to the fingerprint of the microbiota of the mom. And this is absolutely fascinating. The other way the mom modulates the microbiota of the child is through breastfeeding. That's why we are re-promoting breastfeeding in every Western country, because we understand that this is not simply psychologically important, because obviously she hugs, the perfume, the pheromones, and all these kind of things, and the tender care. But so important because through the milk, critical microbiota changes will take place, and this will lead to a better long-term health of the child. So really a new world to be discovered and translated in immediate clinical practice.
And to be controlled by the doctors and not to be a self-medication in the wild field.
Well, you know, Dr. Google is making many problems today. So, as I said, it's very important that a doctor dedicates time to explain why to use this, and this drug or probiotic, and to recommend not to do self-prescription. Now, I always ask my patients to carry to me every over-the-counter drug that they take, because I discovered terrible things in terms also of long-term consequences. So self-prescription can be very dangerous because some people say, oh, you know, if one vitamin is good, 10 is better. No. I always use the example of parsley. Parsley is fantastic when you put in food, little quantity, to give fresh scent. But in ancient time, midwives use this parsley extracted to induce abortion in women, and when the concentration was too high, women died from acute kidney insufficiency. So really, natural is good, but we must be wise and have the knowledge to use all the natural things, particularly when we want to apply to a therapeutic domain in a multimodal system. So competence is key.
And final question, perhaps regarding the pharmacists. They are selling many of these products. Is their knowledge well up to date, or what do you think about that?
Well, I'll tell you my experience. I'm doing courses for pharmacists on menopause, on the hormones, all these kind of things. Why that? Because I think that pharmacists are critical, key professional for the health of the community. And very often, women who are responsible for the family health go to the pharmacist, ask for advice. What the point? Good for good advice, but we professionals share the vision, share the basis of knowledge, so then even the pharmacist can recommend some probiotic for another, vitamins, or other things that may contribute to a better health, always recognizing when his or her advice is appropriate, or when it is more appropriate, say, my lady, this is a very interesting problem, but maybe it's more important if you refer to the gynecologist, the gastroenterologist, your GPs, because this means to know the competence and the limits of the competence.
Professor Graziottin, thank you very much, and have a nice and promiseful and successful meeting here in Bangkok. Thank you for coming.
Thank you. I was delighted to be here. Thank you.